Hello, my name is Lili Petricevic, and I'm a CEO of Sheridan Community Hospital. In a minute or so, you will find out a lot more about our story.
Welcome to the Discover Montcalm Podcast, where we are going to look at the communities, the businesses, the attractions, and the people that make up Montcalm County. Here is your podcast host, Duane Weed.
Hello, and welcome to this edition of the Discover Montcalm Podcast. My name is Duane, the host and producer. You can find us on Pandora, Apple, and iHeart, as well as Instagram, Facebook, and YouTube, or discovermontcalmpodcast.com. You can check out all the episodes, grab the RSS feed, put it in your favorite browser, and learn more about Montcalm County. My guest today, we are going to learn a little bit about the small community hospital down in Sheridan. Lili, thank you so much for making the trip up here. I can't wait to learn a little bit more about your journey. Thank you. Let's start with getting to know you just a little bit. Can you kind of give us, like the Reader's Digest version of your story that brought you to Sheridan?
Sure. Good morning, Duane, and thank you for having me. It's a pleasure to be here on your podcast and also to tell you a little bit about Sheridan Community Hospital. To answer your question, the road was long for me to end up in Sheridan Community Hospital. I actually come originally from former Yugoslavia, Slovenia, now called, and that is where I finished my nursing school, finished up the rest of it, and my bachelor's and master's degree here in the United States. I have had lots of experience in the nursing aspect of the profession and many different areas as well, including leadership and bedside nursing and so on, as well as some experience in the third-party payer world. So those experiences brought me 5 years ago to Sheridan Community Hospital, which is a small critical access hospital here in Sheridan in the middle of the Lower Peninsula of Michigan. And we have started that journey intensively in recovery in the Sheridan Community Hospital about 5-7 years ago. Today, we're here and we're going to be talking a little bit more about it.
When was Sheridan Community Hospital first founded, and where was it located at that time?
It has a long history, actually. Thanks for asking this question. It was located in the same spot on M66, a little bit further down south from the current location.
Okay.
It was established in 1944 by two physicians, local physicians, Dr. Jagno and Dr. Seeley, who wanted really to provide the care to the local community that time in Sheridan. They had this small country house on, nearby, and they just wanted to make that as a hospital. Provided the care 24/7, delivered some babies, and treated people as they came. And actually, they had at least 4 or 6 beds actually for patients to stay overnight if needed there. So that history kind of continued, and there are still actually descendants of these physicians in Sheridan area, which is very cool.
Oh, is there really?
Yes.
That is cool.
It's really neat to know that some of one of the Dr. Seals, I believe, granddaughters is a nurse and was working in Sheridan in prior life as well. So as they established this hospital, that just continued, the care continued, and it was, needed in the area. In 1950, actually, a new location was purchased, the land was purchased, and they put it where is it currently now.
Okay.
And this building is, like I said, since 1950. They have done some remodeling here and there, and then later on in 2014, I believe, they created they built a PCP office, which is the family practice office that is just right across the street in the same campus, if you want to call it,
Sure.
of the property. So ever since 1944, we've been really providing the care here in the Sheridan and the local area and local towns and cities and villages. And I think they've done a really, really good job.
How does a small community hospital survive in this day and age?
Good question, Duane. As you know, the healthcare has really changed through the decades in the United States, just overall, where they were at, how they were, providing care, and then how did they get paid and so on. So as the times change, hospitals really have to adjust to that, those changes as well. Sometimes it goes well, sometimes don't. Same was with Sheridan Community Hospital. It had its ups and downs, and if you look at it, a few years ago, 7-10 years ago, they were having a hard time. However, about 7 to 5 years ago, the new leadership was put in place, and we have really strived all these times, to get where we're at today.
So the landscape's been changing. Healthcare's been changing. You had mentioned a critical access hospital. What is a critical access hospital?
Yeah, good question. So critical access hospital is the type of the hospital that CMS, our Medicare, Medicaid payer, or the government has decided that this is very needed in rural spaces. And what it is are the hospitals basically that provide immediate care, right? They're usually placed in areas where they're far away from the big centers, if you will. And we would stabilize those patients if they come to us right away, because the care needs to be provided as soon as possible, right?
Right.
So that's what we do. We provide that care. We see how we can treat that patient, and usually we are able to treat them until their health and discharge them home. However, if we're not, we stabilize, and if patient has a needs, let's say for the major heart surgery or brain surgery or anything like that, we have contracts with the bigger centers where we would be transferring those patients to.
Okay. So the local people have a place fairly close for that immediate care to stabilize them, as you said, before they go off to, and I'm sure from your location, you have Lansing, you have Grand Rapids, you have, wherever your contracts, are, that's kind of what your care is. Now, do you also treat patients right there? I'm sure it's kind of a variety of things.
Absolutely, you're correct, Dane. Only, those big cases we would be transferring out because we want to make sure that our patients receive the best care that they can and the needed care that they deserve. But yes, we're able to treat patients. Majority of our cases are actually treated in our hospital. We have services, that they can do that, service lines, specialists, and the physicians, and, providers, and nursing staff, and everybody else that can really provide that care. Majority of our patients are treated here. We finish the treatment and send them home. Okay. And one interesting part that we have as well is the swing bed program, which is called swing bed. Everybody's, what is that? Right?
I was just going to ask you, what does that mean?
So what that is, it's actually ability that our hospital has to treat the patients and rehab them, so subacute rehab, so to speak, to be able then to go independently home.
Okay.
So, which is kind of nice, because usually these centers, bigger hospitals and so on, they have to transfer patients if they're really not ready to go home yet. They just need that little boost of the physical therapy and the little therapies and recovery, if you will, before they go home independently. They have to be transferred to the different facilities. Yeah. With us, they can stay in our hospital. So we just changed the level of care.
Another advantage of a small community
Absolutely.
hospital.
And patients stay in a community. They're close to home. They don't need to be transferred anywhere else. Families then don't need to travel that far to visit and so on. Everybody's busy. Days are busy. And with our farming community, we know how that goes during the summertime specifically, right? So it is really advantage to have this in the community locally and, providing the same level of care basically and everything else that we can, provide in the urban areas.
And because of the landscape, life doesn't always make it easy.
Absolutely
and
not.
When you came in 2020, you were part of that new leadership team. When you came in to where you are now, and I don't need to know all the details, but what were some of the things that you addressed when you first got here that were immediate, and how has that gotten better today?
Well, it was a challenging time. If you recall, that was the time where the COVID was
Yes.
actually just announced and started. The pandemic.
Welcome to the new hospital.
There you go. That was exactly how it was. So it was a little bit of a challenge. Hospital itself did not really have a good standing, if you will, financially, nor with the patients and, the reputation in the community. So we had to tackle this with the multiple, ways and, from multiple sides. What we did is we kind of, seen the situation financially where we were at. We had some assistance, at that point of a time, some donations and so on that we utilized in a good way. And then one service at a time, one patient at a time, and one department at a time, we start turning that around. But it was simultaneously working on a revenue cycle, working on the patient, and customer service, working on the level of care that we can provide, getting the providers, good quality providers, back into the hospital.
It sounds to me like you went challenge accepted. Let's get to work.
There you go.
And it's great that you've brought it to where it's at today.
The Discover Montcalm Podcast wants to thank West Michigan Technology and Design Solutions, WGLM 106.3 FM, DW Video, and Business Growth Engine. Thank you for your support.
Over the past 5 years, has there been a moment that you went, oh, I'm glad I'm here. I'm seeing, what this community needs. I mean, have you had one of those out-of-body type of experiences, so to speak, that you went, okay, we got this?
Sometimes ignorance is a bliss, right? When you go into the things, right? And I was thinking about that when I got into this position. But soon after I started in Sheridan Community Hospital, I noticed this community needs this. It was something that, with the COVID on the top of it, was very, very challenging for the population to remain healthy, for the, employment, just, area was really a challenge, to have anybody, any business that was hiring at the time. As you remember, there was a lot of layoffs that was happening. We were very lucky. We didn't need to do that. So we really worked hard on that, where we did not have layoffs at all. But we needed all those staff, with us. So that being said, yes, I did have those moments or two. However, very quickly I noticed that is what this area requires. We need to have a viable hospital. We need to have successful hospital. And why not provide a same level of care that urban population has here in this realm, where we really are, fostering a lot of farming community, a lot of young people who are looking and growing into the healthy individuals and so on. So yes, that's kind of what it got me going and, gave me a little bit of a wind in my wings.
Everybody needs that little, and, we all know life is like a little wave. It just keeps up and down. The services that you provide, and I'm going to assume something, so I need you to tell me if I'm correct here. People can come to you. There's specialists that come from other hospitals in on a certain day of the week, and people can schedule stuff locally. Is that true?
One thing that we need to know that we're one of the only 4 right now left independent hospitals left in Michigan.
Okay.
All the rest of the rural hospitals are usually associated with larger centers. All these systems that provide care, and they're part of them. So as a small hospital, we had lots of challenges because of that, right, as well. So what we decided to is we were seeking good talents, good specialists that have some good reputation out there, right, and start making a contracts with them to bring them here, not full-time,
Right.
But because there's no need for full-time at this point in time, but, once or twice a week or every other week or so, to be able to provide that care here for the people who need specialized care.
So they don't have to travel to Lansing or Grand Rapids or wherever.
That is correct.
And so it's again trying to meet your need of meeting the needs of your customer base by trying to get those specialists there.
Correct. With that, we decided, we kind of looked at the community needs. What is it that we need, right? There was a huge need for orthopedics, for example. There's a lot of injuries happening around and so on. So we got the orthopedic services on. Today we have 3 surgeons, actually, orthopedic surgeons that are there. So our coverage is pretty much very, very good for the patients. Yeah. Same we started with one neurosurgery, spine neurosurgery, and then continued with 2 additional ones that they're really go-getters, and they're very renowned professionals and physicians in the community and United States. So Little Sheridan Community Hospital has actually been now on a list for a couple of the procedures that we're doing it in our hospital as first in Michigan.
Okay.
One of them is MRI spectroscopy, which is the process of the MRI where actually neurosurgeons can look as which disc and which area of the spine is giving a pain and really focus on that surgery right there instead of, kind of guessing and doing the other methods and so on. So it's really precise, actually, method of determining that. Another one is barricade. We're using a cage for the spine surgeries where stabilizes the spinal disc, basically spinal vertebral disc, and actually prevents further surgeries in that area.
Okay.
So, we're really getting some good talents on board. We then slowly got urology because that was the need in a, area quite a bit. We have a pain management, working on a second physician to joining us. Mm-hmm. We have also wound care, services, senior life. We started a senior life program as well.
Yeah, we're all getting older.
That's right. And our population of baby boomers is just growing, right? Yeah. There's a lot of issues when you have, with the elder population, when they lose their husbands or wives or, their spouses. Mm-hmm. And, going through that grief, it's not easy. So we decided we should probably look at the, population, see what they need, establish that. So slowly and surely, we came from 2 specialists in 2020 to 10 today.
Wow.
Specialist service lines, more providers because we have, like I said.
So the horizon looks good at this point from the last 5 years of you kind of steering the ship, growth. So as we sit here in 2025, the horizon for Sheridan Community Hospital looks good. It looks good.
It's challenging, but it looks good. We have a plan. We just finished our strategic plan, next 5 years, and we have lots of projects on that on that plan.
Well, I'll tell you what, as you go through this, I'd like to have you back maybe in a year, and let's talk about some of this strategic stuff. As you start getting it implemented. I mean, planning is consistent. I mean, you never stop planning. Before I ask you a couple more your opinion questions, is there anything that I haven't discussed with you that you would like to make sure that we say here on this podcast?
Sure, Duane. Thank you for asking that question, and just want to kind of talk a little bit about that strategic plan. One of the things on that strategic plan is we need a new building, and we're actually looking and trying to gear towards it to build a new hospital. It's going to be in the same place. We already have the land there, but the building is getting old, and we really need to kind of update the infrastructure.
It's from the 50s, right?
Yes, exactly.
I mean,
building codes are a little different today, right, than they used to be in the 1950s. So we got to upgrade that. Our hospital facility right now is very well maintained. I'm so proud of our teams that are maintaining that, keeping it clean, keeping it sterile, keeping it, up to speed, if you will. But the costs of that maintenance are really high. So we're feeling that, getting a new building is going to be a lot cheaper to maintain, if you will,
Right.
and it's going to give us a lot more abilities to expand, to grow, and to provide a good facility for the population of patients
and for
that
the
we're going to care for.
technology that we have
Absolutely.
here. I mean, it's. I can see where it's not just, oh, we need a new building.
That's right.
It's really big. Well, I thank you, but I have a question. I mean, you've been here for 5 years.
Mm-hmm.
You weren't from this area. You came here. What does Lili like to do on your free time?
Okay.
What do you like to do on your free time around Montcalm County or even outside of the area? You know, how do you discover the area?
Yeah. Lili has some, not much time, free time, but when she does, my husband Mark, who both of us, all of us, my family lives in Lowell. We've been there about 30 years now. And we love, rural area, rural spaces.
Mm-hmm.
Love to go for walks. We actually utilize a lot of, white pine trails that actually were now just expanded, biking and walking and so on. Love the nature. We love that peace and quiet in the rural spaces as well.
There's an advantage to living in small town.
Absolutely. Just kind of exploring little small markets that you can see and stands, right, with the fresh fruits and fresh vegetables and so on. Those are amazing. And, we have to utilize that a little bit more. And that's what we love to do, visit those, buy from the locals and trying to kind of, see what else can we do in the rural spaces. When I was younger, loved to ski and go and, exploring during the winter with my kids, with my two daughters who are now adults and, have their own families and so on. But, Mark and I really love to go into the rural spaces. Horseback riding is another one that you can really, enjoy in the rural space. And we have this where we're at. So in Montcalm County and, near Belding and so on. So, those are the things we love to do.
Well, and one has to keep centered.
Yep.
I love what I do, but I can work too much just like anybody else. And you need to have those. What is your website? How does somebody get in contact with you? Either, obviously just look up Sheridan Community Hospital online and you can find us. But do you have some contact information you can share?
Absolutely. You can call us. You can go online, www.SheridanCommunityHospital.com, and you're going to, you find it there. And you can call us, just a main number. And if you want any special, services, they will direct you from there. Those would be the ways. We are on Facebook. We're on the, social media as well. You can actually follow us as well. We have lots of information on the website, if you want to know a little bit of a more depth about us and so on. We are really active in the community. This last 5 years, we have increased attendance in activities and the, groups of the Montcalm County where we are sitting and having a seat at as well. Just last Friday, we had a health fair in our space where we invite community. We were actually donating a lot of backpacks for the, kids and school
we're coming
kids.
into the new school year. And,
yes.
And it sounds like every business, you're getting involved, you're collaborating with other people. It's, you're not on an island by yourself. You're reaching out and you're giving back and doing all the things that good stewards of the community should be doing. So,
absolutely,
Lili, I want to thank you for taking the time. And like I mentioned earlier in the interview, maybe in a year or so we should get together again and you can bring us an update on what maybe a new building project or, hopefully that works out. But again, thank you for stopping by and, thank you for taking the time. My name's Duane, the host and producer of the Discover Montcalm Podcast. You can find us on discovermontcalmpodcast.com as well as on our socials, and you can find us on different various podcast platforms out there like Pandora, Apple, and iHeart. If you have an idea, you have a business, you have an event, or you have a festival or something, a community, get in contact with me at 231-250-9624. I'd love to tell your story. You know, we are just growing. We've been doing this for over 3 years, and I have not even started to touch on all the stories that are available in this county, and I cannot wait to start sharing them and learning, but it starts with you. On that note, remember to buy and shop locally.
Follow the Discover Montcalm Podcast on Facebook, Instagram, and YouTube. Catch every episode at discovermontcalmpodcast.com, Apple Podcasts, Pandora, and iHeart. Want to be a guest on the podcast and share your story? Contact Duane at 231-250-9624. That's 231-250-9624. Thank you for supporting the Discover Montcalm podcast.